If you or a loved one is living with cancer, you probably have two focal points: how to rid yourself of it and how to prevent it from coming back. You'll get some terrific information today on Cancer Concepts and Complements with Dr. James Belanger. We'll explore natural medicines which may enhance conventional therapies, share cutting-edge research, and offer insight on how diet and natural medicines can play an important role in treating and preventing cancer. The information presented herein is in no way intended as a substitute for medical counseling. Now, here is Dr. James Belanger.
Hello, everybody. Welcome back to Cancer Concepts and Complements. I'm your host, Dr. James Belanger from the Lexington Natural Health Center. Today, I'm going to focus my discussion on talking about the immune system in cancer. And I'm going to discuss various abnormalities that are commonly seen in people that have cancer, abnormalities in the immune system, that is. And I'm going to talk to you about natural medicines, various natural medicines that can make the immune system work better and correct a lot of these abnormalities. But over the last 3 shows, I've been talking about chemotherapy and all the different natural compounds that can help prevent resistance to chemotherapy drugs. But even if you make, chemotherapy work better by adding natural medicines to it, it's very unlikely that the chemotherapy will be able to destroy every single cancer stem cell. And if just a handful of cancer stem cells, or the mother cells of this cancer, survive that chemotherapy, if the immune system is in bad shape, those cancer cells can just start to replicate from 2 cells to 4 cells to 16 cells and start to come back. And, chemotherapy does not correct the imbalance in the immune system. And most likely a person that got the cancer in the first place has some imbalance in their immune system to start with, and then they just went through all this chemo. And if it wasn't combined with natural medicines, then their immune system may be even in a poorer state afterwards. And radiation, too, can affect the immune system. And then again, if the cancer is not completely killed by that chemotherapy regimen or by that radiation, or completely removed by surgery, if that immune system is not functioning good, those stem cells can start to replicate again, and the person can get a reoccurrence. And so this is why this topic is a huge thing to talk about. Because if we don't correct this, then it can start to come back. So there are some chemotherapies, too, that have actually been shown to make the immune system function worse afterwards. And sometimes it can persist for up to 6 months later. For example, there's a chemotherapy drug called Cytoxan. They actually use it to suppress people's immune system that have autoimmune diseases. But it happens to have some anti-cancer effects, and it's given with breast cancer, for example. And there's a research study done in the journal Cancer in 1985 that said people that had Cytoxan to treat cancer, their natural killer cells did not function well after that. And sometimes the effect persisted for up to 6 months later. And same thing with other drugs. Methotrexate is a drug not too commonly used now, but it's used for lymphoma. They use that also to treat autoimmune diseases right now, like rheumatoid arthritis. And it has an immune suppressive effect, even though it also kills cancer. So, and that might persist too. So it's important, like I mentioned, to correct these imbalances in the immune system as soon as possible, during chemotherapy, after chemotherapy. So just in case that chemo doesn't kill everything, that the immune system will be able to take over. Radiation, some people think radiation, because it's just targeted to one spot, is not affecting the immune system like chemotherapy. But no, it does. Inside a tumor are white blood cells. So the immune system might start to react to it and trying to start to fight it. And radiation kills the cancer cells and those immune cells that are also in there. And so it's quite common that after a person undergoes radiation, especially if a larger area is radiated, like in Hodgkin's disease, that these cancer-fighting cells called lymphocytes often decline. And they don't tend to go back up to normal without some kind of support. And so that's an area I want to talk about, how there's natural compounds like thymus extracts that are really important when people undergo radiation to make sure that their immune system doesn't get too harmed from that and recovers. Because lymphocytes, these cells that are in the tumor, some of them are actually fighting the cancer. And there's different types of lymphocytes that you might have heard of, called the T cells and the B cells and the natural killer cells. These are cells, they're classified as lymphocytes, and they all tend to decline with radiation, even just breast radiation. So it's absolutely essential to correct a defective immune response in people when they are, especially if they're in remission after chemotherapy or surgery or radiation, to prevent it from coming back. You might say, why isn't my doctor giving me anything to help my immune system? It's just not a common practice. They don't have a lot of drugs right now that work through the immune system. After chemotherapy is finished with and radiation, some people, like with breast cancer, go on something tamoxifen that blocks estrogen receptors, or some drugs that lower estrogen, or people with lung cancer after going through chemotherapy go on a drug called Tarceva that blocks a growth factor that stimulates the growth of the cancer. But very few people end up going on something that helps their immune system to fight the cancer. And I'm going to get into it. It's the immune system is a complicated thing to deal with, because there's so many different abnormalities, and that's part of the reason. But this is, I'm really passionate about this because if you didn't catch my story in the first radio show, I had, testicular cancer, and I had 3 surgeries to remove it all. And then they said, well, we think we got it all, and let's see if it comes back. We'll do CAT scans, we'll do blood work every 3 months or so. And if it comes back, you will need chemotherapy. And I said, well, I really don't want to, have to go through chemo. That for a young guy, I was 20 at the time, the chemos that they use for testicular cancer can increase your risk of getting leukemia later on in life. And then it affects your ability to have kids. And I wanted to have kids. And so I'm like, come on, there's got to be something else I can do to prevent a reoccurrence. And I was already studying pre-med things, so I had a knowledge about medicine. Said, is there anything I can do to help my immune system or dietary changes? And, I was basically flat out told that, no, there is nothing I can do. Just go back to, my original ways of, stress and eating not the greatest and stuff like that. And it's we either got it all or we didn't. And if we didn't, chemotherapy. I mean, testicular cancer is one that does respond to chemotherapy, but other people have types of cancers that after undergoing chemo, radiation, surgery, if they happen to be able to, go into a remission, they might have a high rate of getting it to come back. If it's, say, more aggressive types of cancers, like even, early stage pancreatic cancer has a high frequency of coming back if they happen to catch it early. And ovarian cancer, you have surgery, you go into chemo, it looks like you're in remission, very typical, it comes back. And so to take that period, that interim where you're waiting, doing CAT scans and blood work, that's a perfect time to do some blood tests, evaluate the immune system, see where the imbalances are, because there will be imbalances. The cancer formed in the first place. It was not detected by the immune system in the first place. It was able to grow to the extent that it grew when it was found. And again, chemotherapy, the radiation, if you had that, does not correct that imbalance in the immune system. It might even make it worse, and then that thing persists for when you are in remission. And if that chemo did not kill every single cell, or that radiation didn't, or the surgery wasn't able to remove it all, again, that immune system defect is still there, and it starts to come back. So, and you can identify that stuff in the blood test. That's what after getting this information from the surgeon saying there was nothing else I could do, that's when I started diving into the research. And, so 24 years later here, I am much more knowledgeable than I was at that time. And still I feel like I don't know a lot. If you go to PubMed, PUBMED.gov, you can look up all this stuff. It's unfortunately not being presented to patients. There's just so much information being published every day on all kinds of things. And if there often isn't a drug attached to it, people often don't find out about it. Doctors don't know about it. And it's just really hard to keep up with all the research that is coming through. But there's a lot that's been done on blood tests that assess immune imbalances and natural medicines that can affect these different imbalances. But it's different for every person. So I think, like I said, part of it is the reason why doctors aren't giving people anything to help with their immune system is because there aren't really any approved drugs, except for a couple, which I'll mention in a second, that are used to help keep people in remission. And there's so many imbalances that happen in the immune system that it's very difficult for one drug to affect them all. And I'm going to go over all the different things, and you'll understand it's not as simple as just taking, some pill and your whole immune system reacts better to cancer now. There's all these different processes that happen. So it's very difficult to create a drug that's going to affect them all. So a lot of the immune therapies that have come across the research and gone through the channels haven't really shown to do a heck of a lot in improving survival and response rates. There's a few, like in kidney cancer, there was this interleukin-2, but it really doesn't tend to work that great. But it got approved for the use to treating kidney cancer. And now there is one for melanoma called ipilimumab that has been shown to have an effect on improving survival that affects the immune system, and a drug they're using for hormone-resistant prostate cancer called Provenge that can help improve survival a little bit. But these two drugs that are available, they only affect one part of the immune system, and if more parts are affected and dealt with, I think there will be some better results. But like I said, it's not as simple as a simple one drug and all the immune parameters change. And also, people need to be categorized, just like women that go on tamoxifen have estrogen-positive breast cancer. They don't go on tamoxifen if they have estrogen-negative breast cancer. So to put everybody that has cancer on some ipilimumab or Provenge and these other drugs, it might not totally fit every person. And there might be some other abnormalities in the immune system that aren't being addressed. And if those are addressed and use that in combination with a drug or some supplements, then you can get the whole immune system to work together to elicit a much stronger immune response. But it's going to take more than one drug or one agent, one natural thing to do that. But this ipilimumab, which is being used for melanoma right now, it targets this thing called CTLA, which is something that transmits these inhibitory signals to prevent the body from reacting to the cancer. And this drug blocks this CTLA thing, and it has been shown, it's one of the first drugs in a long time to make a difference with metastatic melanoma, and it's been shown to help improve, keep disease more stable for up to 24 weeks in like 10 to 35% of the people, and improve survival. The only trouble is it costs a lot of money, $30,000 every 3 weeks for this drug. And people that tend to respond to the drug tend to get a lot of side effects because it stimulates the immune system so much that the immune system not only attacks the cancer, but attacks the healthy cells too. So people end up getting colitis, where the immune system attacks the bowel, or they get autoimmune hepatitis, where the immune system attacks the liver, or their immune system starts attacking their thyroid. And those people are the ones that tend to have the good response against the cancer because the immune system really got turned on. Well, we're going to talk about some natural medicines today that have been shown to actually improve survival too, but don't create those kinds of side effects. So I think the drug is good, but I think more needs to be looked at the natural things that aren't going to create these kinds of toxic symptoms. We want to first do no harm. That's important. This Provenge is another drug that is approved for metastatic prostate cancer that no longer responds to hormone therapy. And now this is even more money than ipilimumab. It's like $90-something thousand a month for this. But it's an interesting technique where they take the person's own cells, they take a blood sample, and they take these certain immune cells out of the blood called antigen-presenting cells. They're like inspector cells. And then they extract these cells and they mix them with proteins that are found in prostate cancer to get the cells to start to learn to recognize these prostate cancer proteins. And then they infuse these cells, these immune cells, that have been now educated and know what to identify back into the person's body. And they do that a few times over the course of a month. And it has been shown to improve survival by about 4 months. Not a huge improvement in survival, It's well tolerated, but it's $93,000 a month. And there are some natural things that we're going to discuss that look very promising that are going to be fractions of the cost that help these dendritic cells or these antigen-presenting cells, or you can call them an inspector, and getting them to see cancer cells better. And again, they are a fraction of cost, and more needs to be studied on them. Because $93,000 or $90,000 for every person is going to bankrupt our health system. So that's another advantage of these natural medicines. So I'm going to take a break right now, and then when I come back, I'm going to give you an analogy to help you understand how the immune system responds to cancer. So this is Cancer Concepts and Compliments. I'm your host, Dr. James Belanger.
This is Cancer Concepts and Compliments with Dr. James Belanger. The information presented herein is in no way intended as a substitute for medical counseling. If you would like to find out more about the Lexington Natural Health Center, please visit LexingtonNaturalHealth.com. That's LexingtonNaturalHealth.com. Now, back to this week's program.
Hello, welcome back to Cancer Concepts and Compliments. I'm your host, Dr. James Belanger from the Lexington Natural Health Center. Okay, so we're talking about the immune system and cancer, and we're going to discuss the various abnormalities that are commonly seen in people with cancer in the immune system and talk about natural medicines that can help correct it. But first, I want you to get an analogy in your head that will help you understand a normal reaction that the immune system should undergo to help react to cancer. This is a normal reaction. So I always tell people to think of this analogy. So, okay, say, you're going to buy a house. Okay, you always hire an inspector to come to that house and go and look for any problems with the house. So you have these inspector cells, and we have, in our body, we have inspectors, and they are different types. They have different names. One's called a dendritic cell. One's called a M1 macrophage, and one's called a B cell, B as in boy cell. And so you could think of maybe you hired a few inspectors because you didn't want to trust just one. So there's 3 inspectors that come to the house. So that's what we have, 3 different types of inspectors. But the best inspector is called the dendritic cell. It's much more capable of finding all kinds of little issues and presenting it to lots of different messengers. So, okay, so you got the inspector that comes, and the inspector takes a look at the house and then says, okay, hey, I found a problem here with the roof. You got a leak. There's a leaky roof in this house. So, you are maybe going to be the homeowner of this house. So you might get on the phone and call somebody that fixes roofs and get an estimate of how much it's going to be. And so you're sending like a message in response to what that inspector told you. And we have these cells in our body that are called T cells that send messages. They're called the T helper cells. And once they come in contact with an inspector and have a little discussion, should we say, with these inspector cells, they then may alert somebody or some other cell. So they may send a message. Okay, and then so you, back to our analogy, you send that message and you call somebody that fixes roofs. And, they might come by the house and, give an assessment, or if actually you are fixing the roof, they come by and they fix it. So we actually have cells that, once they get the message, arrive at the site where the cancer is and help destroy those cancer cells. And they are called killer cells. And there's different types of killer cells. There's natural killer cells. And natural killer cells see things that other killer cells don't see. And we also have these other killer cells called killer T cells. And they see things that natural killer cells don't. So it's like a backup system. And then there's also what's called the natural killer T cell. So that's kind of the normal process. And those are the cells. So you can think of them, as an inspector cells, messenger cells, and worker cells or killer cells. And the messages are all being transmitted with the help of these chemicals that are released by the cells. And they call them cytokines, these chemicals, cytokines. They're just compounds, proteins that are released by these cells to either, turn on or turn off the cell. So you can think of it as like a phone line or something, or just a contact, the inspector talking and telling you the problem. So there's a communication. The cells do it with these cytokines, and there's different types of cytokines. There's one called TNF, or tumor necrosis factor, and there's one called IL-1 or interleukin-1, and there's something called interleukin-12. Well, those three cytokines, the TNF and the IL-1 and the IL-12, are just compounds that help the inspector communicate to that helper messenger cell. And without those three compounds, the messenger doesn't really get activated, and the inspector doesn't, get activated and mature too, and it misses things. So those chemicals are really important. We're going to talk about how it's a common thing with people with cancer, where those compounds aren't being produced in good enough levels to really even mount a response. So it's like, without those chemicals, the inspector can't communicate to the messenger and tell them, really the problem. Maybe they don't speak in the right language. You can think of it that way, or there's just the inspector, misses the problem and not communicated, or just doesn't get their point across what the problem is. So these compounds are really necessary. And then the T cells, these helper cells, these messengers, they need to communicate to the killer cells. And they do that by releasing compounds called cytokines called interleukin-2 or IL-2 and interferon gamma or IFN gamma. So these are chemical compounds that are released by the T helper cell, the T helper 1 cell to be specific, that helps activate the killer cells of the workers. So this is like you getting on the phone and now you call the people to help fix the roof. So you're sending a communication. You just got the communication from the inspector, and now you, the T helper 1 cell, is sending another message saying, okay, hey, here's the address, come to this house, take a look at it, and then the killer cells arrive. So, and then the killer cells again are the natural killer, the killer T cell, and the natural killer T cell. Those are the different types of workers that show up. So there's all kinds of problems that can occur with this process. One thing is the inspector may not alert the messenger very well. And it could be that maybe there's not enough inspectors on the job. It's a common thing that there is actually a deficiency of these dendritic cells in people with cancer, especially as the cancer advances, and I'll talk to you about why that may happen. But one of the things is that the cancer cells, mutations happen in cancer cells. That's how a cancer cell forms. If something happened to the DNA of the cancer, and certain genes become activated or deactivated that allow that cell to not behave like a normal cell. Well, there's some genes that are activated that allow the cancer cell to start producing this compound in excess. It's called TGF. I mentioned it in the first radio show, but it's called transforming growth factor. And it's a compound that cancer cells can produce directly, or cells that are surrounding the cancer can produce it. But when it's produced in excess, it interferes with the inspectors arriving at the site. So you could think of it as, okay, you called the inspector to come to the address, but you gave the wrong address or something, or they have a breakdown on the way there and they weren't able to arrive because there was some message that was distracting them. Either they got the wrong message or they were diverted. And so TGF, being released by the cancer cells, diverts the inspectors, keeps them away. And so we definitely want to target that and measure that in people. So I'll get to that. But there happens to be a study that was done in this journal, APMIS. It stands for some big long thing, but APMIS in 2003. Yeah, they correlated. Basically, they measured the amount of these inspector cells in a tumor and found out the more the tumor produced the TGF, the lower the amounts of the inspectors. It totally correlated. So, and you can measure this TGF because it does spill into the blood. And if a person has a high amount, that can be a negative prognostic indicator that it needs to be lowered to allow the immune system to get in there. So we talked about the Provenge thing for prostate cancer, where it actually takes these inspector cells out of the blood, mixes them with proteins from prostate cancer cells, and then infuses the inspectors back in. Now the inspectors know what to look for. It's like somebody telling them, okay, I heard this house has a problem with the roof. So they are already on guard, ready to inspect that roof very carefully. So they already got an idea. But if the cancer is producing this TGF in high amounts, it keeps those inspectors out, according to this one study and many other studies too. So this is where maybe Provenge would work better than just adding 4 months to survival times if it was combined with some compounds like natural medicines that can decrease TGF. And maybe measuring TGF in people that have this refractory prostate cancer that are on Provenge and those that have elevated levels add something to it. See, this is what I was saying about immune therapy. It's not as simple as just taking one compound. A lot of the immune therapies haven't been shown to be that effective because they're just dealing with one part of the immune system, and some other part is preventing that drug from working. And you need to treat it as a whole, and everybody's an individual. Not everybody has an elevated TGF, but those that do, then something like Provenge might not work. And so then you add something for that and individualize it to the person. So that's one thing, is that the inspectors might not, be in high numbers in the tumor to even do the inspection process. But there's another issue, is that you could think about the inspectors do not really become activated. They show up at the job and they just do not do a great job, and they don't see issues with the problem, or they do, but they don't become too excited about it to tell the messenger, to tell you that there's a problem. See, once the inspectors, like these dendritic cells, find a problem, they're supposed to produce what's called TNF and IL-1, and then they come in contact with the messenger, the T cell, and there's a whole activation process that happens. And if there isn't enough of these compounds being produced, and TGF is something that can stop the production of these things, this TNF and IL-1, then the inspector doesn't really get activated or really alerted to activate that messenger cell. So it's really important not only that the inspectors arrive at the job, but that they become activated once they are there. And these compounds, this TNF, this IL-1, and then I also mentioned IL-12 is a really important thing to have. Why are these messages maybe not developing in the cancer? Well, cancer is not just, cancer cells. I mentioned in some previous shows that there is this stroma that surrounds cancer. There's this network of proteins we had talked about, proteins that are composed of the same things that are found in blood clots, called fibrin and fibrinogen, and proteins found in scar tissue like collagen and fibronectin. So there's like a barrier around the tumor, but on top of it, there's a set of guards. The cancer cells release these chemical attractants. They're called chemokines that attract cells to them, and these cells produce inhibitors. It's like maybe the owner showing up at that house and paying off the inspector and saying, hey, don't tell them about my roof. So I want them to buy my house here, buy this house, don't tell them, So there's these cells that arrive at the site of the cancer that, drawn in by the cancer cells, that send inhibitory signals to the inspectors, telling them not to react. And those inhibitory signals are like that TGF that's being produced. It's produced directly from cancer cells, but it can be produced by cells that are surrounding the cancer, that are helping it. And those cells are also immune cells. So, when you hear somebody say, oh, we want to boost your immune system, well, we want to boost what's called the type 1 immune system. So there's like different types of immune cells. Some will react to cancer, like what's called the type 1 helper cell and the type 1 killer T cell. And there are some types of cells that will actually protect the cancer. And so one of the cells that protects the cancer is called the regulatory T cell. It's a cell that is a suppressor cell. We have it in our body to help prevent our immune system from attacking everything in our body and causing an autoimmune disease. We need these cells or we could get autoimmune diseases. And I mentioned that drug ipilimumab blocks the suppressor cells, and then the immune system ends up attacking the cancer and the healthy cells. And then that's a problem because you get colitis attacking the bowel, you get hepatitis attacking the liver, you get autoimmune thyroiditis attacking the thyroid. And there's some natural things that can do it in a much more gentler way without causing this massive autoimmune disease. But we do have these cells called regulatory T cells that can surround cancer, and they are sources of that TGF thing that I mentioned, that transforming growth factor. And that prevents, like I said, the dendritic cells from arriving and becoming alerted. So you could think of it as, like I mentioned, the owner of the house just saying, hey, don't tell them, stopping the message, stopping the communication between the T cell, the messenger cell, and the inspector. There's also another compound that's released by these regulatory T cells that has a very similar function to this TGF, and it's called interleukin 10 or IL-10. And there's all kinds of research. You look them up on PubMed, pubmed.gov. pubmed.gov, pubmed.gov, where you type in measuring interleukin 10 or IL-10 in people with cancer. And people that have higher levels of interleukin 10 tend to have worse prognoses, or lower survival rates, shorter remission periods, and same thing with measuring this TGF. So these are compounds that, for the most part, prevent the activation of the immune system. It's not completely that simple, but in general, you think of them as stopping the inspection. And they come from these regulatory T cells. And there are natural compounds that I'm going to talk about that can lower those. There's also these other types of cells that arrive at the tumor site. They're called T helper 2 cells. And they produce another set of chemicals that also send inhibitory signals that stop the message from being sent to the worker cells. So I mentioned that, okay, once, say, the inspector does get communicates the message to the messenger, then, maybe going to be owning this house, get on the phone and talk to some roof people. Well, what happens if somebody cuts the phone line and you never get a chance to call that roof person? That's what these TH2 cells, the T helper 2 cells, do. They stop the T helper 1 cells from communicating to the killer cells. And they do that also by releasing certain cytokines. But these cytokines, unlike that interleukin 2 that I mentioned in the interferon gamma, send stopping signals or suppressive signals. And they produce, there are other interleukins called interleukin 4, interleukin 5, interleukin 6. They also produce interleukin 10, like the T regulatory cells, and interleukin 13. And so you can measure these as well. And if you see high levels of any of these being produced, that often signals a bad response to cancer, a type 2 response, which is going to protect the cancer from the inspectors and the whole the alerting of the killer cells. And so that's how the cancer just sits there undetected somewhere in the body and just keeps growing and growing. And that, like I said, is often present at diagnosis. Chemotherapy, surgery, radiation debulk or decrease the amount of tumor cells present. But then those tumor cells that are still alive start doing the same stuff, attracting these suppressor cells, these T regulatory cells, attracting these T helper 2 cells, creating a barrier around themselves made out of that collagen and that fibrin stuff, and then just start up the whole factory again, rebuilding. And none of the drugs, except for these couple that I mentioned, stop that process from happening. And so, maybe tamoxifen takes away the estrogen for a while, and the aromatase inhibitors take away the estrogen, or with prostate cancer, the drugs are lowering testosterone to try to stop, or their fuel, so they're not as active. But once they mutate and work themselves around it, the immune system is still in, like I said, the bad shape, maybe even worse shape, and it starts to grow again. So, that's something that happens. And so another thing that can happen too is that there's not enough messengers. Certainly, if you got on the phone and you called a whole bunch of people to help, or then you're assured that somebody is going to arrive at the place. So we do have, these T helper 1 cells that start to proliferate or expand, because they're the messengers, and the more of them that there are, the greater the message will take place. And same thing with the killer cells. If there's a lot of killer cells present in the body, then you're going to have to get the problem fixed more. If there's more people that come and show up that fix the house, then they'll be able to fix it better. So it's important to check the T1 cells, the quantities of them, so you know that you have lots of them to respond to the inspectors and alert the killer cells. And it's important to check the numbers of killer cells, too. And there's research showing that people that have lower levels of these things, which are called lymphocytes, often have shorter survival periods and remission times. Then there's even some tests that can be done to see how well these killer cells perform. If, again, back to the analogy, if you call these people to fix your roof and they show up and they're not very good at fixing the roof, well, then it's not going to get fixed. So just because the message was sent, inspection takes place, doesn't mean that everything's going to be better. So there is a test where they take a person's natural killer cells out of the blood, mix them with cancer cells, and see how well they perform. And there's all kinds of studies done on that. There's one that was published in the journal The Lancet. I can't remember the year, but they just took people, healthy people that didn't even have cancer, and looked at natural killer cells over a course of 11 years. And those that had poorly functioning natural killer cells had a 2-fold greater risk of getting cancer in that 11-year period. And that was published in The Lancet. But there's a bunch of studies showing, too, that if the natural killer cells aren't functioning well, they're more likely to get relapses in people with cancer, or not respond as well to chemo, because, again, if chemo doesn't kill every cell, the immune system needs to be able to kill the rest. If the killer cells aren't performing well at their task, then there's a problem. And there's natural things that can make killer cells work better. So you're getting at the idea is there's a whole system of steps. Each step has to take place properly, or the next step doesn't occur. And even if you get one step to work better, and that next step and the next step after that isn't working good, then still you don't get a response. And that's the issue with a lot of the immune therapies not working. So I'm going to take another break, and when we get back, we're going to get into some more specific on what natural medicines can actually start improving these abnormalities in the immune system. This is Cancer Concepts and Compliments. I'm your host, Dr. James Belanger.
This is Cancer Concepts and Compliments with Dr. James Belanger. The information presented herein is in no way intended as a substitute for medical counseling. If you would like to find out more about the Lexington Natural Health Center, please visit LexingtonNaturalHealth.com. That's LexingtonNaturalHealth.com. Now, back to this week's program.
Hello, everybody. Welcome back to Cancer Concepts and Compliments. I'm your host, Dr. James Belanger. Before the break, I was giving you an analogy to help you understand better how a normal immune response to cancer works, talking about an inspection, and then a message is sent, and then worker cells or killer cells arrive at the site of the cancer and destroy the cancer. And all three of those steps need to take place. And then also we need to decrease the suppressor cells that are starting to surround the cancer that stops these helper cells and these killer cells from attacking it. Okay, so now let's get into some more specifics. So I mentioned that it is the first thing is these inspector cells, and there's 3 types of inspector cells: the dendritic cell, it's called, the macrophage or the M1 macrophage, and then the B cell, B as in boy. The dendritic cell is the most important one of these inspectors. It looks like an octopus. So it has these long extensions. And so it can take, because it has more arms than a macrophage or the B cell, it can take all kinds of pieces off of the cancer tumors, like especially, dead cells that have died in the cancer that have released their compounds or proteins that are in the vicinity of the tumor. If the inspectors are in there, these dendritic cells, they'll take a whole bunch of these samples, right? Then they'll leave that site of the cancer and go to a nearby lymph node, a draining lymph node, and find a T helper 1 cell that is a perfect lock and key fit. Has to be a perfect lock and key fit to the proteins that were found. But it can present to a whole bunch of different T cells because it has all these arms. Eventually, it's going to find one that has a lock and key fit. And what's really important about it is it can activate like immature T cells that have never really responded to anything before and get them to become activated and mature. And the other inspectors can't do that. The other inspectors can only activate T cells that have a memory to some of these proteins from the past. But the B cell is really important because if there's a very tiny amount of cancer, it could see that possibly and amplify the signal to really get the body to start to notice it. So that's what's important about the B cell. But so back to the dendritic cells, since they are the most important, they can be measured in the blood. I'm not aware of any lab that's doing that like a reference lab on a regular basis, but there are research labs that are doing it because it's difficult. There's not that many in the blood, and they have different markers and stuff like that. But the research that's been done saying that it is a common thing for people with cancer to have low levels of these dendritic cells in the blood and then lower levels in tumors. And that's been reported in the British Journal of Cancer. 2007 is one of the studies. They found low levels in breast cancer patients, lung cancer, kidney cancer, colon cancer, stomach cancer, myeloma, various types of cancers. So, it's a common finding. Unfortunately, I don't know of a lab that tests it, so I don't check it, but I always put people on, or like to put people on, a particular product that helps increase that. So I'll get to that in a second. Then I mentioned that some of the low issues with the dendritic cells are due to the TGF, so we need to target TGF. And then we also need to help mature the dendritic cells so that they are capable of stimulating the T cells. If they're immature, they're not going to be very good inspectors and alert the T cells. And what matures them are things like IL-1, TNF-alpha, and IL-12. Okay, so let's start with doing things that improve dendritic cell numbers. As I mentioned, British Journal of Cancer found that it's very common for people to have markedly reduced levels of dendritic cells, especially as the cancer advances, that the cancer releases things that prevent the bone marrow from producing dendritic cells, or actually even allows the bone marrow to start producing more immature dendritic-like cells that don't function properly. So it has an advantage doing that. So anything that improves dendritic cells. And there is a natural compound that's been studied in people, and that it has been shown to increase dendritic cells, and it's called AHCC. It stands for this, it's called active hexose correlated compound. It's basically a mixture of what's called polysaccharides, which are like glucose molecules linked together, and some minerals and lipids or fats that are derived from the cultured broth of the shiitake mushroom. So this is being produced in Japan right now, and it's this particular mixture. It's a patented thing, so they don't tell you exact mixture, but it's basically from this shiitake. So it's not just ground up shiitake mushroom in a pill or anything. It's this particular mixture of these, they call them polysaccharides, linked together. It's not the same thing as, sugar or anything, or starch, but different linkages of glucose molecules together, and they call them like alpha glucans. Well, anyhow, so they gave some patients this, and this is a study done in nutrition and cancer in 2008 in Japan, and there's a 64% increase in the dendritic cell counts after 4 weeks of doing this. And so this is really important because it can, in essence, replenish the pool that often declines as a person gets more advanced cancers of the inspectors. So there's more inspectors on the job to alert the body that there's cancer. And so they have studied this for like primary liver cancer. There's a cancer called hepatocellular carcinoma, a primary liver cancer, where they did surgery. and then they gave this AHCC, this active hexose-correlated compound, and compared it to a group that just had surgery alone. And again, even though you have surgery and you think you're getting every single cancer cell out, if there can be satellite lesions, cancer cells, collections that are outside of the surgical margin that are present in other parts of the liver that can't be seen. And so it's a high chance that it can come back. And again, surgery doesn't correct any abnormality in the immune system for the most part. And so if those dendritic cells aren't responding and stuff, then it can start to come back. So AHCC has been shown at least to help increase the dendritic cell counts. And they found that 34.5% had a reoccurrence in the AHCC group. I'm not sure, I can't remember how many months they had followed them, but 34.5% had a reoccurrence in the AHCC group versus 66.1% in the control group. So, cut the recurrence rates by half there with just this simple thing. And again, you combine it with some other things that affect other parts of the immune system, maybe you can get even better results. But this is where immune therapy really stands out, is once a person's in remission, whether it's the surgery that helps remove a bulk of the cancer or chemotherapy and radiation, it's very important after a person is in remission to aggressively treat any immune abnormality and correct that so any cell that's left over doesn't start replicating. Once there's a lot of cancer cells present, they have a lot more mechanisms in place that keep them from hiding from the immune system, and it's more difficult to treat. But once the cancer has been removed and debulked, you've taken away a lot of cells, and so the few cells that are left at first are not going to start producing all these inhibitory compounds and don't have maybe that stroma that has built up yet to protect them. And so that's when you want to treat it right off that bat, right at that point, so that it doesn't start to form. Once that stroma forms and those suppressor cells collect around it, then it's harder to treat. It's not impossible, but it's harder at that point. So that's one thing. And like I said, unfortunately, there isn't a lab that I know that measures dendritic cells it's readily available, but it's available at research labs right now, so they're able to do that. So I put people on AHCC a lot, but I have no way of verifying if it really is increasing the dendritic cell counts or not. But there is at least a human study that says that it can do that. Okay, the next thing is I mentioned that TGF is a compound that can be released by cancer cells themselves, and that can also be released by these regulatory T cells, these cells that are suppressor cells, like guards surrounding the cancer, preventing them from being inspected properly. So we want to measure TGF, or transforming growth factor, in the blood. And there's all kinds of research showing measuring that. You want to make sure that it's low. If a person has a higher level, they're more at risk for reoccurrences and shorter survival periods and things like that. And there's a naturals compounds that have been shown to lower TGF. One I mentioned previous shows called proteolytic enzymes. There are these enzymes that are found in foods, like in pineapple. There's this enzyme that's found in pineapple called bromelain that is classified as a proteolytic enzyme, meaning it breaks down proteins, like TGF is a protein. And there's enzymes found in papaya called papain. And there's enzymes found in pancreas, or pork pancreas, or any animal's pancreas, and our pancreas, that have been shown also to break down this TGF. And there's studies done by this Dr. Lucia Desser in Vienna, Austria, where she measured TGF levels in cancer patients and gave them proteolytic enzymes and found that they reduced them when just given orally. So these enzymes, when given orally, entered the blood, because they're given in high doses, and they're enteric-coated, so they're not digested in the stomach or in the first part of the small intestine. So they get absorbed, and they affect different proteins in the body that clear out or bind the TGF and remove this excess amount of TGF that can be produced by the regulatory T cells and the cancer cells. And there has been some studies done in various German medical journals. Most of them I can't read because they're all in German, but some summary articles in the 1990s show that patients often live longer when their enzymes are combined with chemotherapy, and they've done studies in lymphoma, myeloma, colon cancer. So it's a simple thing that to measure is TGF. People that have high levels of TGF could benefit by these proteolytic enzymes. And there's lots of companies that have mixtures of them. The one that has been studied the most is one called Wobenzyme, but that doesn't mean that other ones aren't just as effective or more effective. But it does appear that mixtures of enzymes from pancreas, there's something called trypsin or chymotrypsin, seems to be a very useful enzyme to use. And then papain from papaya and bromelain from pineapple. But again, not everybody has high TGF, and those that don't have high TGF might not benefit as much from the proteolytic enzymes. Those that do have high TGF, it's an important thing to measure before somebody goes on a proteolytic enzyme protocol, and then after to make sure that it is adequately lowering it. Sometimes it works great. Other times I've seen it doesn't lower it very well. And then there's other things that could be used. For example, there's another compound, and it's also from shiitake. It's not the AHCC compound from shiitake. It's something else. So when you eat shiitake, you eat what's called the fruiting body, the mushroom part. But there's this root system under the ground that you don't see. That's really a huge part of the mushroom. It's called the mycelia. And so in Japan, they have studied the mycelia extract, so like the root system extract of shiitake in Japan, and they published in the Oncology Reports 2011. They gave colon cancer to mice, and then they gave some groups the shiitake mycelia extract, the root extract, versus nothing. And after 14 days, just carried out for 14 days, the tumors were half the size. And when they measured the TGF levels, they were 1/7 the level in the group given the shiitake versus the group not given that. So shiitake mycelia extract can be really good also for lowering TGF in patients with elevated levels. And there are some human studies being conducted right now. So far, they haven't released much saying that people take it, feel overall better. Quality of life improves too. But survival things are something that takes a while to figure out. And so they just started some studies 2011. Well, I hope you enjoyed today's show. I'm going to, on the follow-up next week's show, going to talk more about T cells and killer cells and natural things that help strengthen those. So this is Cancer Concepts and Compliments. I'm your host, Dr. James Belanger. Have a great week.
Thank you for joining us this week. Cancer Concepts and Compliments with Dr. James Belanger can be heard live every Tuesday morning at 6 a.m. Pacific Time, 9 a.m. Eastern Time on the Voice America Health and Wellness Channel. We hope to see you next week for another show.